This is Fred Goldstein, and welcome to this week's COVID Insights to Action discussion group. We're excited you've chosen to join us as well. I'm joined again this week by my esteemed physician colleagues, Dr. Nick van Terheyden and Dr. Luis Saldana. And we're going to get into a couple of different discussions today, and happy to accept any questions or comments you might have. We're going to start by talking a little bit about Israel, what's going on there, what we've learned from those who've been vaccinated, and how that might apply here in the United States. And then we'll move on to discussing masks and some of the newer thoughts around masks and wearing them and why those thoughts are coming up, as well as what people are beginning to recommend. So why don't we start first with a little discussion on Israel. And they've obviously been moving ahead, vaccinating a fair number of people. So perhaps, Luis, would you like to start with that?
Sure. I can start with that. Yeah, I've been following this, following their work there very closely. They've been giving the Pfizer vaccine, essentially trying to get everybody vaccinated. Certainly, they have an issue with the Palestinians. They've been criticized for human rights things for not giving it to the Palestinians. But besides that issue, I still think there's a tremendous amount for us to learn about one, the process, but two, the impact of broad vaccination, especially in higher risk groups. And I think we can pretty much draw some nice conclusions or some nice insights from that. Again, this isn't a formal study, but I think there's some pretty good insights. One, they're still struggling with the overall numbers. They have other issues. They're actually kind of in the midst of a third lockdown, I think now, but particularly they've vaccinated over 50% have received at least one vaccine. And so, are partially vaccinated. And a lot of the numbers they've seen among the groups that are vaccinated, the age groups, show that in those that are fully vaccinated, a huge drop in the number of cases in those age groups, a significant drop, 39% in the number in percent of hospitalizations in those groups, and 31% in the same in terms of the illnesses as well. So really seeing pretty dramatic impact on the population level. These are population level impacts, and essentially from what we see there's a couple things we can draw is that nobody's going to get severe illness if they've been fully vaccinated, at least from what we've seen up to now. I'm not going to kind of draw any conclusions with variants and things like that, but certainly they've had variants around, and they're probably still struggling with some of the variants there as well. But there's another thing that's really important to draw from their experience is that it looks like there's going to be decreased transmission as well as a result of the broad vaccination. And that can be drawn from the fact that if they look at kind of overall viral loads, the viral loads in the country are dropping. So I think that's going to also impact the severity. Illness is dropping, and thus is probably a reflection that they're actually slowing the transmission among, throughout the country by this broad vaccination program. We weren't sure whether we could draw any of those conclusions before this experience, but I think based on this experience, I think it provides a lot of hope for us here in the United States in terms of, the way we're going with, our vaccination efforts here ramping up. We're now over 10%, I believe, are vaccinated, at least partially vaccinated of the population, especially the higher risk groups. And I think we've already seen decreased deaths, a significant drop in decreased deaths in the nursing home populations, which were vaccinated early on. So that's a little bit of what I kind of took away from what I've seen from the Israel experience.
So I think great points. It's maybe worth just saying a couple of things about the Israel approach and why it's a little bit different, and also sort of reconcile. One of the things you often hear is, well, that's Israel, or that's the US or whatever. They're different. Actually, they represent a lot of what we have here. They've got a mix of healthcare combinations, put the issue of the Palestinians to one side, but just within the country, they've got challenges. They've certainly got political challenges. Let's be clear. They've had more elections than I think I've had birthdays in the last couple of years. So lots going on there. But they took a really pragmatic approach to this, which was, we're going after the high risk groups, but they addressed it on an age group basis. And we're going to be, simple in that approach, in that if we go to an institution, we're just going to get everybody in the institution, and not worry too much about, gosh, we got somebody that's young. So there was none of this missed opportunity. There was also, a clear sort of approach to appointments, so that people got appointments, but an understanding that sometimes that gets messed up. And they had a sort of a well-recognized process that said, hey, if you want to hang out at these places at these times, you could line up for any spare doses. And in the instances where the spare dose line didn't exist and they had something left over, they went out and found people to issue, and they gave them the second appointment at the time. So really pragmatic, very sort of rapid, and they're way ahead. So, Luis sort of cites the US. Okay, 10%. I was going to say 9%. The next highest is the UK at 14%, and there's nobody else after that. So they're just streets ahead. So there's lots to sort of recommend it. And I think the important thing here is, if you want to suppress these variants, you need to stop the virus, period. Right. It doesn't matter how you do it. And we can do it lots of different ways. But viruses, when they replicate and get into other people, they produce variants. So the less they get to do that, the less variants we have to deal with, the faster we're going to sort of suppress this whole thing. And that's been very effective, I think. I'd be surprised if maybe they'll see variants coming in, but I'm willing to bet that they're not generating variants because they're suppressing the R naught.
Right. It's been interesting to read some of the of what they did operationally. There are 4 health plans in Israel, but they have really strong electronic health records, as we've talked about. So they're able to rapidly identify the individual and say, we're going to go get this group, then we're going to get this group, then we're going to get this group through those 4 health plans. They also apparently paid 2 to 3 times the rate the United States paid for each dose. And put out a fair chunk of money, and then made the deal with Pfizer to go ahead and say, we're going to give you de-identified data that you can then use to further study and learn about the vaccine. And while that's had some questions from a privacy standpoint and that kind of thing, it clearly allowed them to rapidly, they bought a lot of the vaccine, and then obviously made a deal to get more in as quickly as they can. So it'll be interesting to see how it goes. I also did notice that they announced yesterday that all of the immigrants who are in Israel, whether legally or illegally, are going to get vaccinated. They're just going to ask you to show your name and something, and they're not going to have any data to say whether you were here legally or not in the country. And they're going to vaccinate that group now too, which is nice to see. So hopefully we'll begin to see that kind of thing spread out a little bit, as you mentioned earlier, Luis, with some of the other issues faced over there. Are there obviously we're seeing this reduction in deaths and other things. Are there any other unique insights we're getting out of that early on that can point us to a better thing? I know they announced they're going to open the schools except for 10th through 12th grade, I think, or 11th and 12th, but the others are reopening now. Anything else going on there?
Well, I mean, the rate of infection has declined, and it declined pretty early on, if I recall. It wasn't, they reached, I want to say it was around 30%, and they started to see these effects quite early on. So, if I was to pick out something, there's hope if we could get to some level better than the 9%, which just seems inadequate at this point. I don't know what to say about the money side of it. I mean, paying more just meant that they got to the front of the line. Okay, not everybody can do that. Ultimately, we've all got to get, in line. But it's the just get it done was the most important thing in all of this to really be effective in rolling this out. We've got vaccine that's sitting on the shelf, as I understand it, in the US. That's inexcusable in my mind.
Yeah, my point on the dollar amounts paid for it was that they're actually getting a lot of pushback from the country itself. Why did you spend that much for that? And one of the other things I saw that was interesting, maybe one of you two can comment on this, is that they began to see effects after the first shot. And is that right? Yep. And see reductions.
That's correct. That's correct. That's correct. They did start seeing some protections probably maybe a couple of weeks after the first dose and things, and that wasn't clear if that was going to happen. So yeah, that was alerting, and then, again, 2 weeks after the second dose, it seems like, again, I don't think they've had a single severe case, and the number of cases among vaccinated individuals has been, I'm not going to say zero, but it's almost zero.
Mm-hmm. And from a medical perspective, and given the nature of vaccines, obviously this was Pfizer. Can we assume Moderna is going to be similar? And is there a way to then say, well, one done differently might be similar as well, or we just don't know yet?
Yeah, I think we're both pausing for thought there. Don't want to jump into that and say, whenever I hear the word assume and medical and science
Yeah.
and data, I'm always a little bit leery. It's not unreasonable to think that that might be the case, but I don't think there's data to support it. I think what's interesting about the Israel experience is, and you highlighted it, Fred, the fact that they're offering back this data, privacy issues aside, gives you some insights. And if you can tie that back to infection rates and so forth, they may well be able to report and show some demonstrable benefits on the Pfizer vaccine because they've got this wealth of millions of data points.
Right. Right. And one of the other things I found interesting is, and kind of a little different thing on this vaccine, was there's always the question when you're doing your initial studies, whether you've got a broad enough population. Is it a representative population of the people in the country? And we've seen some bias in some of these AI tools, things like that can flow over from doing things like that. But it turns out I was seeing, obviously, there's a real issue with obesity now showing up, and impact of the disease on people who are obese versus others. But the vaccine was actually tested in a representative sample that included folks who were obese at the same rate as they are in the general population, to show the impact that it actually helped. Because there was some concern, I understand, for example, in the flu vaccine doesn't appear to work as well in individuals who are obese for various reasons. So that was nice to see, and obviously as we get more of this data out of Israel, that'll help us as well. Let's get on to the second topic, unless there's anything else to add there, and talk a little bit about masks. There's been a lot of change. Not a lot of change, but a better understanding now, both because of the variants coming out and their impact on spread, and the effectiveness we now know of masks. And that's changed a little bit. Maybe, Nick, do you want to start out with that one a little bit? What's happening with the masks?
Yeah, sure. I mean, masks seems to be the ever recurring changing theme that people complain about. Oh, you said not wear masks. Oh, we should wear masks. Which is it? Well, guess what? That science continues. And, there were some very good reasons why there's been a shift in terms of the advice. But we know categorically from as far back as 1918 with the flu pandemic that occurred at that time, that masks are effective. There's no question. Now, what's happened and what's changed over the course of time is, of course, we've had all of these people piling in to do some incredible studies, both looking at, different materials. We saw a study, I want to say this was several months back, that sort of looked at different materials, very thin materials, not as good. Some of this is fairly obvious. I think one of the things that's come out, and the guidance that's very clear now, is, so we're hearing a lot of double masking. I think the good news is we're seeing it from the leaders in this space. So I want to say that in many of the instances in the White House, in the press briefings, if you note, people are actually showing, you can see that they are wearing 2 masks. And, I think there's some variation in whether you put the surgical mask. The CDC guidance is pretty clear. Surgical mask followed by a cloth mask, and in fact, some guidance that tries to make it as tight fitting as possible, very similar to the N95, which is essentially a sealed experience, and then adding an additional mask. And what I thought was really interesting, I think if I looked at the picture correctly, it was a gaiter, a sort of, pull up thing that you put over the surgical mask, was an additional sort of capability, even a thin gaiter that was pulled up over a surgical mask. So 2 or multi-layered, improves efficiency, maybe not quite to the N95, but gets you to that point. And it's extraordinarily effective and so important with these highly transmissible variants that we are really trying very hard to suppress the spread of.
Mm-hmm. Yeah, I'll just kind of add the CDC did come out today, and I'd urge everybody to kind of look at least see the visuals or the graphics that the CDC shared today. But basically the bottom line says wearing a mask that fits tightly to your face can help limit the spread of the virus that causes COVID-19, which I think, especially with variants, this is probably the biggest thing we can do to stop variants. And they say in lab tests with dummies, exposure to potentially infectious aerosols decreased by about 95% when they both wore tightly fitted masks. The options were a medical procedure mask with knotted ear loops and tucked in sides, or a cloth mask over a medical procedure mask. So, you know, any variant of that, but they're talking about 95% protective. You know, so that's impressive. Other effective options to improve fit include a mask fitter. You can buy these, you know, over the counter, Amazon. It's called a mask fitter, or as Nick mentioned, nylon covering over the mask. So that's the gaiter type thing over a mask. So now you may see somebody with a gaiter, and that may be okay if they have a mask underneath. You just, again, you may not know what they're wearing underneath, but I think now we have so much clarity on this, and certainly with the Biden administration has imposed more mask mandates, so they're really reinforcing the importance of this. And we know that nationally we're seeing cases drop, hospitalizations dropping in the light of these variants. And the UK has had a similar drop, even though they had the variants as well. And I think the key is two things: the vaccination, the things we talked about today, the vaccination, and really good quality masking. So I think those two things, and I think we can ensure that even if we do have another spike related to variants, that it won't be as large or sustained a spike as we've seen before. I'm more optimistic on that if we continue on the path of vaccinating and wearing the masks, efficiently and effectively.
Mm-hmm. Yeah, because one of the concerns I had as I've noticed people thinking about it, and I saw some studies on this, talked about this issue that as the vaccine went out, it kind of almost like took the air out of the balloon in a sense of getting nervous. And so a lot of people, I was afraid, were going to, take it a little bit easier. And I haven't seen that be the case yet. Obviously, it's a concern. I saw one study which said people now consider this a moderate problem versus a major issue for them. And hopefully we won't see that behavior, because you're right, until we get to this point where we're vaccinated and have good immunity as a group, wearing a mask is going to continue. What about some of the thinking now, and we're beginning to hear some differences regarding that, of people who are vaccinated meeting together? And what do we know there? And in other words, everybody that I know is vaccinated. We can all get together. Do we need to wear masks or not? Current thinking, I know Fauci has said that might change coming in a little bit.
I think we will see some CDC guidance on that in the next week or so. I think we will see that. I think one reason they will do that is almost like incentivizing the vaccine. I think you're going to start seeing these incentives. So I think TBD is what I'd say. For now, it's the same precautions. I'm certainly, I've been vaccinated for a little over a week, 10 days now for my second vaccine, and I hadn't changed a thing in terms of how I do. And I think I'd be very reluctant to change my behavior, because if it's worked for me, I'm probably not gonna change it unless I just have an absolutely, really important reason that'll draw me out of that.
Mm-hmm.
Yeah, it's kind of interesting. You talk about the incentive. I think that's an important aspect to this. I mean, we know what works, we know what's best, but there is a balance to all of this to get compliance. And if you can find a pathway that's more acceptable, it's one of the reasons why N95s are not the best option, really, because they're just pretty tough to put on. But these alternatives with the loops that essentially creates a much tighter seal. And I've seen the video of this, and it's quite impressive, but it's not as oppressive as the N95 mask. It gives a little bit of laxity. And I think the same is true with these incentives. Balance things out so that you get people complying, so that we all win by pulling in the same direction.
Yeah, no, it makes a lot of sense. And speaking of incentives, and it sort of reminded me, I'd seen some employer groups are now incenting their employees by giving them a bonus for getting the shots.
Yeah.
You know,
Kroger,
so
I saw
you're
that.
seeing
Kroger,
that
Kroger.
as a possibility as well. And I know, you know, when I consider the whole indoor thing, and indoors is still nervousness for me, it's the one and the two, you know, one on top of the other. And I do notice the fit is much better, and I can really tell that I don't have leakage around the side as I would if I just wear that surgical type mask. So that's been very helpful from that perspective. I know we've got folks on listening. If you've got any questions or anything, please feel free to put them into the chat box, or you're welcome to join us if you'd like. We appreciate you joining us in this event. As we think going forward now, obviously we're starting to see people talk about what the summer or the fall might look like. You talked a little bit, Luis, about, well, we may see another spike, you know, given the variants, but maybe it won't be as big. Are we beginning to now think a little bit further out as to what we might be able to do versus what we're doing now? Is that something we can at least start to consider, but look closer to that date, or do we continue to just say, well, we're going to be like this for a long, long time?
No, I think definitely you're going to continue to see progressive kind of return towards normal over time. It's not going to be the normal, because I don't think we're going to be returning to offices and have big gatherings and things like that. Even restaurants, I think people will be slow to kind of return, though in some places, you know, restaurant never has really changed too much. But I think we will, again, you know, following the Israel kind of experience, that they have started to kind of do that. I think we will continue to see some slow opening. I think they're going to be very cautious in that. I think the CDC is going to be extra cautious on lagging and not getting out ahead of themselves. That's my sense.
Mm-hmm. Yeah, I think it's very hard to predict. Yeah, you know, prior to COVID-19, I was, you know, happy to predict a year, 2 years, 5 years out. This is what's going to happen, you know, with all this confidence. And all this has taught me is that, you know, those predictions, like many of these things, sort of fall by the wayside. It's very hard to sort of have an assessment as to what's going to happen. I like to sort of pitch towards Luis's point of hopefulness of where it's going to be, but also tempered with some reality that says, you know, we have got to execute on all of the things that we know. I mean, if we'd done that 9 months ago, we might not be in this hole. We're now sort of digging out. I think I'm excited about the change and the improvement based on sort of, you know, some positive leadership examples set by folks. All of that's good, but we've got a lot of ground to cover. We have seen it being effective. I mean, just look at the countries that, you know, have fractional numbers of disease and problems relative. South Korea is a good example. I mean, they're not absent any disease, but, you know, small numbers relative to us. Even some countries in Africa where, you know, they focused on these things and people took it all seriously. So we know it's possible. We just have to execute. And I think the other hopeful thing that I saw this week was increased mask compliance. That's a shocking statistic to me, given all of the, you know, that's my freedom, it's this, it's that, you know. I think people are terrified that they're going to be living with this for the rest of their waking life. That's not the case. But, you know, we have to pull in the same direction using all of the tools that we know, because the more that we apply, the faster we can actually bring this under control. And that's worldwide. It's not just the US. Great, we get COVID under control in the US. That's not good enough, because there's still all this international travel and trade. We've got to overcome it worldwide.
Mm-hmm. Yeah, and I'll say one more thing, because it's kind of been a little, it's been certainly overshadowed by the vaccine, is the government is also ramping up testing. Mm-hmm. And especially the use of rapid tests is something that's going to be worth following. They invested a lot, or gave a lot towards the ELLUME Test, which is a company out of Australia that has a self-administered test and things. So that's going to be a space to continue to watch as far as that goes. I think all these things are really part of a more thoughtful strategy, which has really sorely been lacking. It's really looking at this very holistically. And I think that leads to, if we're talking about returning to normal, maybe even next time we talk about maybe a look at travel. What's the future of travel? How does that look there? It'll combine some of the things that maybe we've talked about over time, even within the country or outside the country. I think that's going to be interesting because it's probably going to combine a lot of these things, the masking, the testing, and the vaccination. I think are all going to be huge factors in watching that area.
I know that early on, we obviously, as we were working with some of the clients early, was this idea of testing, and now that's sort of become the norm. And I know, Luis, you sent out some links to some articles, I believe, on some large employers that are now implementing, or maybe it was Nick, testing services.
Yeah, banks, like large banks, we're doing a lot of testing and things, and I think that's going to become also much more normalized for folks, and kind of if they have to have people in the office or in facing customers and such as well.
Yeah, I think we need to remind people that obviously, as you talked about, it's not, you still got to do the mask, you still got to do the hand washing, you still got to keep your distance. And testing is still a critical piece of this. Yeah, well, the vaccines here, we got to be doing some testing. Go on, Nick.
And what's the other positive out of this? I heard that the flu, for 2020, 2021 is like zero almost. I mean, why is that? Because we've all been so good at, being clean and, preventing the spread of the disease. So, there are some silver linings. We've learned some things about all of this. Nobody paid any attention to flu before. In this country, people went to work with flu. What on earth were they thinking? Now I don't think people would do that, right?
That's true, Nick. And hopefully we can change some of that behavior going forward with other conditions as well that they don't show up in the office with, to keep from spreading it. We've tried, I think as you talked about, one of the good things around this was early on making sure as an employer you have a policy that it's okay to call in sick.
Right.
You feel something, it's a sniffles or whatever, please don't show up. Whereas before it was, in many cases in the United States, get on in here, man. We got to get some work done.
Right.
So that's a good change. Definitely a good change. Anything else you guys would like to add, or any questions from anybody? We've got just a few minutes left.
Well, I would just say it's that improvement in public health doesn't stop. Let's suppose, with all good things happening, that COVID-19 disappears. It's no longer a problem. We don't, nobody ever says the word COVID-19 again, in 2022. That doesn't change all of the value add that's happened and the change that's necessary for employers, for colleges. It requires a sort of virtual health approach that was very similar to what we had in the factories. And I think people are going to need help and support to be able to deliver that from experts that understand this, from a population health, from a disease management. And that's really one of the areas that I think we excel and are excited to help our clients and offer them.
Absolutely. Yeah. Well, it's been, again, another fantastic discussion this week, getting into Israel and their vaccinations and some of the things we've learned from that, as well as masks. And if you'd like any more information or would like to reach out with us to get some help on anything, please feel free to go to our website, which we'll have down below, or give us a call, and we'd be happy to talk to you. So thanks again, Nick and Luis, for another fantastic week, and thanks to all of you who attended. We'll have next week's topic up very soon up on the registration page.